A community healthcare worker is somebody that works and serves in the community that they live in. These are people that assist people in vulnerable communities, the poorest of the poor, in terms of accessing healthcare services. Community healthcare workers are at the forefront of primary healthcare in South Africa because there's an issue of affordability for transport to get to hospitals. There's the issue of distance. Community healthcare workers plays that role to bridge that particular gap. The CHWU stipend ranges from anything from 800 to 4,000 rands. Most of the community healthcare workers are women. Some of them are breadwinners within their homes, and some of them are single-parent households, and they use this money to pay for school fees for their children to go to school, buy uniforms, buy food within their homes, and clearly that's not enough. If it was not for the community healthcare workers, it would be a dire situation. This country would be facing a major dire situation. Currently it is, but by God it would be worse off without community healthcare workers.
For me, to be a community health worker, it's not about money or everything. It's about the love of my people, love of my community, seeing my community suffering, and also the call by our government to say they need help. I've been a community health worker for the past 10 years. We started getting 1,000 rands a month. Then it went to 1.5 in 2010. Then 2012, we had to toy as community health workers to say what you're giving us, it's too little, until we agreed for them to increase our stipend with 1,000 rands. So now I'm currently getting 2,500 rands. We are breadwinners at home, supporting, like me, I'm supporting 5 people. 4 plus me, it's 5. And my transport fee to work, it's 700 rands a month, and my granddaughter, it's 450 a month to go to school. The one who's at the child care, it's 300 rands every month. And also I have to buy food, go to work and eat at work. At the end of the day, I end up with nothing. All the money is spent on the transportation and also taking care of my family. You go and do your work wholeheartedly with all the love and passion. At the end of the day, you are not recognized. Most of us community health workers, we've been trained, so we are going nowhere with that training. So with that skills and everything, if the government does not recognize us, who is going to recognize the community health workers after doing such a great job for them?
So the ward-based outreach team policy is really trying to reorganize, formalize and standardize a very large infrastructure of lay and community work that emerged around HIV and TB. And it became clear that with time the health service was completely dependent on these workers. The HIV program cannot run without a small army of lay health workers who actually effectively the glue holding this program together. If community health workers are to provide an 8-hour day, 5 days a week, they need to be appropriately remunerated. That is a key issue that has to be addressed, and at the moment it's not. It's a threadbare, underfunded infrastructure that cannot make a serious difference while it's in that state.